Now, B-type natriuretic peptide was named this because it was first found in the brains of pigs, but in the human body, it is predominantly released from the ventricular myocytes. It essentially has the same action as AMP, except that it has a much longer half-life, which makes it helpful in ruling out heart failure in patients with shortness of breath. So if someone presents with shortness of breath, you can use the BMP to help rule in or rule out your diagnosis. Now, many things can cause the BMP to be elevated, so therefore it has a better negative predictive value for heart failure than positive. So this means that if you have someone with shortness of breath and you check a BMP and it is not elevated, it is very unlikely that they have heart failure. And now while we're on it, how do you actually diagnose heart failure? Well, if you don't know, that's perfectly fine. This is something that you're much more likely to encounter once you hit the wards. Now, the diagnosis of heart failure is actually through a set of criteria called the Framingham criteria, and you can see these here. To actually make the diagnosis, you need 2 major criteria, or 1 major and 2 minor criteria. Now, as you can see here, most of these are your classic heart failure findings, with orthopnea, elevated JVP, lower extremity edema, and dyspnea on exertion. Alright, now back to BMP. You can actually give a synthetic homologue of BMP, called Natriuretic, as a part of treatment for heart failure. This, just like BMP, will increase salt excretion as well as cause vasodilation to help improve volume and pressure overload within the heart. And now while this drug is available, I'll go ahead and tell you that it's not really used in clinical practice, but it does make a great mechanism of action question that can show up on your test.